In Australia, currently over 90% of skin cancers are managed by GPs. Imagine if you start referring all your skin cancer patients on to specialists and the hospitals, they won't cope. Currently, the waiting lists to get into a public hospital for a skin cancer are long, and where I work in Newcastle, it's next to impossible to get a patient in, especially if there's something I can't do and I need to send it on, that they need to be done in hospital, then it's next to impossible to try and get a patient in. The bulk of skin cancer in Australia is small and easily managed. It's only the few cases that are large, advanced and beyond the scope of most people that need to be referred. So if you start bombarding the hospital and the specialists with every little simple skin cancer that can easily be managed in primary care, then the system's going to fail even further.